Welcome to Concept in Medicine. In today's session, we shall be looking at CURB-65 score. CURB-65. Let's begin by getting to know what CURB-65 score is. The CURB-65 score is just an acronym from the components, and it's a simple, validated clinical scoring system used to determine the severity of community-acquired pneumonia, the treatment modality, and mortality in patients with community-acquired pneumonia. So that is what CURB-65 score is. Now let's move ahead and look at the component of the CURB-65 score. And as I initially said, that the CURB-65 score, the name CURB is CURB-65. The name CURB-65 is derived from the component and put in the form of an acronym, making CURB-65. Let's move ahead and look at the component of the CURB-65 score. So for the component, we have CURB and 65. So let's take the first one, that is C. C correlates to confusion, or if you are using the abbreviated mental test score, if the total score is less than or equal to 8, you give a score of 1. If it does not match the criteria, you give a score of 0. So if it fulfills the criteria, you give a score of 1. The U correlates or stands for urea. And when do we give a score of 1? When the urea level is greater than 7 millimoles per liter, you will give a score of 1. The next one is the R. That stands for respiratory rate. And for the respiratory rate, for each criteria to be fulfilled, the respiratory rate needs to be greater than or equal to 30 per minute. And if it is so, you give a score of 1. And then blood pressure, the B stands for blood pressure. And for the blood pressure criteria, we are looking at the systolic blood pressure and the diastolic blood pressure. And how does that criteria get fulfilled? If the systolic blood pressure is less than 90 millimeters of mercury and or diastolic blood pressure is less than or equal to 60 millimeters of mercury, you will give a score of 1. Then finally, 65. The 65 stands for the age. And what is the criteria for the age? If the age of the patient is greater than or equal to 65 years, you give a score of 1. So in all, the total score should give you 5. Let's move ahead and look at how to interpret the CURB-65 score. To interpret the CURB-65 score, we are going to have these various categories. The first category is going to be the total score. The next one is going to be the risk level. The next one, severity. The next one, treatment modality. And finally, 30-day mortality. So if you do the CURB-65 score and you have a total score ranging from 0 to 1, that gives you a risk level of low, a severity of mild. Then the treatment modality is going to be an outpatient treatment with oral antibiotics. That is oral empiric antibiotics. Then for the 30-day mortality in a patient with community-acquired pneumonia is going to be 2.7%. 2.7%, meaning that if we take 100 people with community-acquired pneumonia, about 2.7 of them are likely to die from the community-acquired pneumonia. That's 2.7. The next one is if the total score is 2. That makes the risk level moderate, and that makes the severity also moderate. And what will be the treatment modality? For this, there is going to be 2 treatment modality. The first one is going to be an outpatient treatment with oral antibiotics with close follow-up. It means that this patient needs to be coming to the outpatient department for close monitoring. That's what we mean by outpatient treatment with oral antibiotics with a close follow-up. That's the first alternative. The second alternative is that you can hospitalize that patient and treat him or her with intravenous antibiotics. That makes it an inpatient treatment with intravenous antibiotics. And what will be the 30-day mortality in such a patient? It will be equivalent to 6.8%, meaning you're having almost about 3 times the mortality rates, 3 times the mortality rate in the mild severity. Let's move to the next one. If the total score is greater than or equal to 3, what are we talking about? And if the total score is greater than or equal to 3, then it means that we can divide it into that category. If it is equal to 3, and if it's equal to 4 or 5. If the total score is equivalent to 3, that makes the risk level severe. And if it's equivalent to 4 or 5, that makes the risk level highest. So the risk level is highest when the total score is 4 or 5. Then if you go to the severity, for a total score of 3, 4, and 5, the severity will be what? Severe. Now, for the treatment modality for a total score greater than or equal to 3, you are going to consider an inpatient treatment with intravenous antibiotics with a consideration for a possible intensive care unit admission. Again, if the total score is greater than or equal to 3, then this is what is done. You consider an inpatient treatment with intravenous antibiotics with a possible intensive care unit admission, meaning that it's of severe severity. And for the 30-day mortality, it's going to be, greatest with comparison with the other two. Now, if we take the total score of equal to 3, the 30-day mortality will be equivalent to 14%. And if you take when the CURB-65 total score is either equal to 4 or 5, then the 30-day mortality will be the greatest. That will be 27.8%. 27.8%. With that being said, CURB-65 score is a simple validated clinical scoring system used to determine the severity of community-acquired pneumonia, the treatment modality, and the mortality in patients with community-acquired pneumonia. I believe that we've learned something new today. Let's subscribe to my channel, share and recommend to friends, and do not forget to put on the notification button to be the first to receive updates about my uploads. Once again, feel free to comment the next concept you would like to see on my channel in the commentary section. You already know me. My name is Dr. Del, and once again, this is Concept in Medicine. Bye bye.